Hello, this is Dr. Mercola, and the response to my request for questions has been absolutely extraordinary. Thousands of people have written in with questions that they'd like me to answer in this format. If you haven't done so yet and you'd like to ask a question, all you need to do is click on the video link that's below this video, and it will give you the instructions on how to do that. But before you write your questions, and for those of you who have already written, I've been astounded at how many of these questions have been already answered on my site. For those of you who don't know, I've written over 60,000 pages of information that's already uploaded free on the site. And all you have to do to access that is write your question in the search box on the top of every page, click search, and there's a strong likelihood that you'll find an article that I've written that already addresses your question. So try that first. But our first winner today is from Elaine, who lives in Baltimore, Maryland. And her question was that millions of people have actually had LASIK performed with good results, and she's wondering what I felt about that. Well, Elaine, thanks for writing that question, and for doing so, we're going to give you a free copy of my vision course which further expands on the answer to your question. And the simple answer to your question is that I don't recommend LASIK surgery to anyone. I strongly discourage the use of LASIK surgery. Does that mean LASIK surgery does not work? Absolutely not. It provides benefit to millions of people, as Elaine clearly pointed out. However, what those millions of people fail to appreciate is that this is an artificial surgically induced solution that in no way, shape, or form addresses the underlying visual dysfunction. And because it doesn't, it runs the risk of having to introduce another solution later down the road. So let me just give you an example. Most people tend to use this for correction of nearsightedness, and it is really a wonderful relief not to have to be bothered with the use of glasses. And when they have the surgery performed, it works well most of the time. In a very small percentage of the case, especially if the person has seen a skilled ophthalmologist, the likelihood of a complication is very small. But there are a large number of people who've actually had complications and they have permanent visual dysfunction as a side effect of the surgical intervention. So that's definitely a risk. It's not a serious, significant risk, though, if you're seeing a skilled clinician. However, the more significant challenge, and the one that virtually everyone who has this procedure has to understand, is that as you age, you will have additional visual dysfunction because, again, the underlying issue was never addressed, and that visual dysfunction will cause you to require an additional corrective intervention. Now, that intervention is certainly not going to be a corneal transplant where you actually take the cornea off and put another cornea on. But see, once you have LASIK surgery performed, it's very difficult to do another LASIK surgery. So really your options are limited to having to wear glasses, which is the exact reason, or contacts, which is the exact reason that you had the surgery to begin with. See, when you have LASIK surgery, what it does is permanently etch in the cornea, the surface of your cornea, a corrective surgery. So it's like having glasses or a contact lens permanently etched into your cornea. And you know that if for many people your corrective solution changes with time, so you can't change the correction on LASIK. That's the problem. So that you're going to have this intervention and you have this permanent correction into your eye that you cannot change. Now, I think people also use LASIK surgery for correction of farsightedness, and a common form of farsightedness is presbyopia, or the visual dysfunction you get for most people acquire as they age. And this is actually something I encountered about 10 years ago or so, and really started me on my search for a program that could help me relieve the embarrassment of having to wear glasses. I mean, I was applying all these natural health principles and supposed to be a leader in the natural health movement, and I was really embarrassed that I would have to wear reading glasses. So I was ashamed, and as a result of that, it motivated me to find a natural intervention that could actually help restore my vision, and I did. And now the principles of the course and the intervention that I use is capsulized in our vision program that we're going to give to Elaine, and it's written further about on these pages if you're interested. But it really is an extraordinary program. It worked phenomenally well for me, and we've had thousands of people use this to successfully restore their vision, and now don't require the use of glasses or contacts and they can see normally, and they haven't had to use LASIK surgery. Is it as simple and easy as LASIK surgery? Absolutely not. It takes a lot of work and a lot of effort and energy, but it does address the underlying reasons why a person is not seeing properly. And it costs a lot less than LASIK surgery. So if you're interested in that, you can certainly read these things. But hopefully this helps you, Elaine, and gives you the specific reasons why I don't recommend LASIK surgery for anyone.